And time now for a look at your health. April is Autism Awareness Month, and there has been a lot of talk lately about new treatments and even a study that suggests kids can outgrow autism. Joining me now is Dr. Mitchel Goldman from UCSD. First of all, this new information that came out this week that 1 in 88 children is now being diagnosed with autism?
Yes, and it's even worse because there's a 23% increase in the last 5 years. And you know, boys by age 8, it's almost 1 in 50, so almost 2% of all boys. So it's definitely a problem. It's definitely growing. We don't know why it's growing so much. Probably it's because we're being able to diagnose it better, but there's definitely something that's causing it.
So you think it's a mix between more cases and better ability to pick out the cases that would have already been there?
Yeah, but
okay.
but it's not just the better diagnostic. Something is going on in our environment which is leading to this development of autism.
Okay, let's stick with that then. So in the environment, meaning something that we're either eating or breathing or around, and I know there have been so many studies that already have dispelled the belief that it could be the vaccinations.
Yeah, it's absolutely, positively, without a doubt, not vaccines, because the development of autism happens when you're developing in your mother's wound. So it happens in utero. Studies are now being done in Norway where they're tracking everything that a pregnant mother can be exposed to up until the pregnancy and then beyond pregnancy to see what could be causing it. The leading theories are it's something in the environment, something that we're either breathing in, like air pollution, or something that we're actually drinking in that's causing the brain to rewire. Because autism is basically a rewiring of the brain. The neurons in the brain, those are the cells that communicate with each other, aren't the same in autistic patients and in non-autistic patients. And so we're trying to figure out what's causing it.
And there are so many degrees of it. People that are completely uncommunicative, and yet whether it's true, I've heard highly functioning people who have Asperger's who actually become geniuses in their given field.
No, absolutely. The key thing in autism is not just a lack of intelligence, because as you just said, most of the people are actually highly intelligent. It's a lack of the communication ability. So the symptoms of autism are manyfold that we can look for. But the key thing is inability to communicate. Also, if they're doing repetitive movements, if they're actually doing, listening to sounds and having, like too much stimuli coming into them. So there's a lot of different things that we're seeing up there on this screen, but we should be on the lookout for. But when we see these happening, the earlier we can intervene, the earlier we can take a child, even 1 or 2 years old, and start getting them more communicative, starting to regulate how they're listening and interacting with others, the more we can actually help. And
so tell me signs that a mom or a dad can look for.
There's so many, Lauren. It's, the inability to look at someone, speech development that's pretty delayed, repetitive motions. The extreme is when children start to try to hurt themselves by hitting themselves and things of this sort, crying out loudly for no apparent reason, being disturbed by too many noises. There was a story of a young kid that was crying at school all the time. It's because he heard all these noises bouncing off the walls continuously, and he didn't know how to process it. So what we can do is actually teach the children how to process those noises, how to process the lights, and they can actually be almost cured of their autism.
Well, and I want to bring that up right now. This is new information. I've not heard this before. Curing it?
Well, it's just about, we have areas or ways to literally rewire the brain so that the neurons are not functioning the same way, and we can actually teach the patients or their little kids to cope with their environment. And it's said that almost 10% of all patients with autism really will grow out of their autism by age 14.
Well, let's hope that we learn why that happens and be able to increase that number up to 90%.
Yeah,
99%.
you got it.
Dr. Goldman, thanks so much.
Good to be here.
Jen?